Let's begin. I'm very pleased to welcome our speaker today, Dr. Mariana Brussoni. Dr. Brussoni is Director of the Human Early Learning Partnership and Professor in the Department of Pediatrics and the School of Population and Public Health at the University of British Columbia. She's an investigator with the British Columbia Children's Hospital Research Institute and the British Columbia Injury Research and Prevention Unit. Mariana is a founding member and on the board of Outdoor Play Canada. Her cross-disciplinary research investigates child injury prevention and children's risky play, focusing on parents and educators' perceptions of risk and design of outdoor play-friendly environments. She partners with practitioners and policymakers in early childhood education, schooling, municipal planning, and recreation provision, with the aim of creating environments where all children can thrive in healthy societies. Thank you so much for joining us, Mariana, and I'll pass the floor to you now.
Thank you so much, Zindu, for that warm welcome and for the kind invitation to present as part of this webinar series and to speak with you all today. I'm delighted to get this opportunity. And I would also urge you as we go through, and as Zindu had said, please add your comments and questions and feel free to interrupt. I'm happy to be interrupted. I would rather deal with questions and comments as they come. So don't feel like you have to wait till the end. So maybe we can get the slides up. And while that's happening, I want to acknowledge that I am joining you as an uninvited settler on the lands of the Musqueam people here at UBC in Vancouver. And I'm so grateful for my opportunity to live, work, play, raise my children on these lands that have cared and soothed so many of us and provided our sustenance and opportunities for play, even before we knew to thank the land. And also to acknowledge the traditional stewards of the land who have been a part of stewarding this land since time immemorial. Now, I spend a lot of time thinking about the traditional stewards and the people whose land I'm on, particularly because my research is so much about fostering connection between children and the outdoors. So if we could... I'm not sure, I've lost track of who's putting up the slides.
Sorry, 1 second, a bit of technical difficulty here.
Got it. So for our time today, just as we're going through all of that, I wanted to talk to you about outdoor play, about risky play, and how this is so important in the early years. And so our time today will cover 4 main areas of work. So what is outdoor play? Why is it important? What gets in our way? What are some of the hangups that we might have, in terms of supporting it? And how do we support it? We're going to put up a poll in the moment because what I find is so helpful in terms of getting people understanding the importance of outdoor play and really connecting with this is to think back to your own childhood play memory. And so I'd like you to do now is think about what was, if you think back to your favorite childhood play memory, where were you? What were you doing? Who were you with? The kinds of sights and sounds and smells that you felt. And we're going to put up a poll now so that you can share where you were. Were you indoors or were you outdoors? Okay. I think we can share the results of this poll. Okay. Are people seeing the results? Yes. Okay, great. So really interesting, right? That everybody who answered the poll mentioned that they were outdoors. And this is, we've done research on this and it just really, these are very typical results. And so we can stop sharing the poll. Actually, I think I can do that. So what is it? Why are we outdoors in these favorite childhood play memories, and what are we doing, and who are we with? And I would invite you to, in the chat, share some of those memories. I would love to hear some of them. And if we were together, I would actually be asking you about those memories. But some of the common things that people talk about are things like, being able to move their bodies in ways that they can indoors, and joy and fun and hanging out with their friends and going places that they, wouldn't go with adults, and just had this kind of limitless sense of time and figuring things out for themselves, with their friends. And what are we going to do? How are we going to do it? Resolving disputes, those sorts of things. So it turns out that all of those characteristics of outdoor play make it unique, make it different from indoor play, and make it really, really critical for children's health, development, and well-being. So if you could go to the next slide. So I think this quote really sums it up, that outdoor play is increasingly recognized as a foundation for healthy child development. And you can find out more, actually, because the Early Childhood Encyclopedia has a whole chapter on outdoor play with all sorts of great material. So next slide. So why does it matter? Why is it so important? And as I said, there's if you think back to your own favorite childhood play memories, I think it will be quite intuitive. So if you go to the next slide, some of the research has indicated lots of benefits. So just to summarize them briefly, we have lots of developmental benefits. So if you think about socio-emotional learning, so you have children who are kind of figuring things out for themselves, figuring out what they're going to do, resolving disputes, managing emotions, and those sorts of things that are really important and critical for socio-emotional development. Cognitive development. So the outdoors brings a lot more kind of diversity of opportunities than indoors, constantly changing, opportunities for new exploration, doing experiments with the world and how the world works and their own body, making plans and carrying through those plans. That's important for executive functioning. So all sorts of benefits for cognitive development. Physical development. We know that kids play differently outdoors than they do indoors. First of all, they're more physically active, they're less sedentary, but they're also moving their bodies in ways that they don't indoors. So you think about how kids are allowed to be more rambunctious, to do more running, to do more of those physical movements, to climb trees and figure out how their body works. So all of that is really important for physical development, physical literacy, and physical activity. Mental health. There's a great deal of research around the mental health benefits, and I'm actually going to dig into that with more detail in a moment. So if you go to the next slide, it's really quite clear that play is the engine of optimal child development, and outdoor play plays a very critical role in that. So next slide. The problem that we've seen, though, is that there's been a shift in the opportunities that kids have for outdoor play over time. So we're seeing a lot more indoor, sedentary, screen-based activities that mark the differences between generations. So next slide. So one of the concerns we have is that we're dealing with some very serious mental health problems in terms of mental disorders. And the latest research, and this is pre-COVID data, as you can see here, is that we have overall a decrease in hospitalization visits for children. But when you see the pink lines, the hospitalizations are going way up for those visits related to mental health conditions. And so this is very concerning. And in fact, here at the Human Early Learning Partnership, we collect population level data on the well-being of children, and the trends are even more concerning as we go on. And so it's important for us to pay attention to this. And if you go to the next slide, I just want to unpack some of the benefits of outdoor play for related to children's mental health and well-being. So first of all, you have change and challenge, right? So what that means is that the outdoors is constantly changing. It could be with changes in the weather, in the seasons, new materials emerging. And so that keeps kids engaged in trying that, but it provides them with opportunities for challenge, right? You know, and this part is specific to being outdoors, but you know, being able to climb things, being able to try new activities, to explore new areas of the environment. Those are very critical in terms of the outdoor environment in keeping kids engaged. Another really important aspect of the outdoors is attention restoration. You know, your attention kind of perks up. And I don't know if you know, you've had these experiences where you've had a long day and you're very tired. You get the opportunity to go outside, experience some nature, maybe a walk in the woods, or just even seeing some trees, and you perk up. You have the greater ability for self-regulation. Your emotions kind of become more, you know, able to be managed. Related to that is stress buffering. So the stress buffering effects of nature. And also the research shows the importance of nature and early positive nature experiences for environmental awareness. So kids understanding why the outdoors and nature is so important, and then carrying that forward in their lives in terms of feelings of the importance of environmental stewardship. And next slide, in terms of mental health specifically, there's a critical growing body of research around outdoor play and the risks that kids take along with it around, for example, anxiety management. So to unpack this a bit, some really interesting research out of Helen Dodd's lab in the UK showing that, you know, the kinds of emotions that we feel when we're kind of outdoors, engaging in risks, kind of pushing ourselves and pushing our boundaries, those are really strong physical and psychological emotions. So the way that the body reacts is similar to if you have a stressor, like you have a bear chasing you or something like that. But what it does is, in exposing kids to these experiences and these bodily sensations, they learn that they can manage these strong emotions. They learn that not every time that their body experiences that it's a negative, stressful event. And so they become better at distinguishing those things, and also developing kind of a sense of self-efficacy around their ability to manage those. Not only that, related to self-efficacy, if I'm sure you can all relate to the times when kids, in your care, your own children have tried things that have gone beyond their normal kind of comfort level, and they succeed, and they're like, I did it. So this sense that they did it on their own without, adults making it happen for them is really important for their self-confidence and self-efficacy. But also, let's say they fail and things go wrong. They also learn, I can manage those failures. I don't need, adults to oversee this and to pave the way for me. So that's really important experience. The antiphobic effects. So more and more research showing, so for example, it's very common to have phobias. And in fact, things like separation anxiety are a critical part of development. They're evolutionarily important. We want kids to be near their caregivers if there's danger so that they can be scooped up. And around 12 months is when things like anti-separation anxiety are at their peak. But what we find is that if you don't have experiences that allow those those to be extinguished, like experiences where you're away from your parents, or you're trying heights or things like that, those don't get extinguished, and you have an entrenched anxiety disorder. And emotion management, I think I've talked about, but it's really the sense of those strong emotions being able to be managed. So next slide. So we know that 1 in 4 children in Canada enter kindergarten developmentally vulnerable in a variety of areas. And so it's our duty really to think about these early childhood experiences and how we can provide the best start to reduce these vulnerabilities. And outdoor play is a really important part of that. So next slide. So what I want to touch on now for just a few minutes is what gets in our way. What are the hangups we have and how can we manage those? So next slide. So first of all, to introduce kind of the concept of the kinds of things that are really important for an outdoor and risky play supportive environment. And there's 3 key ingredients: time, space, and freedom. So time, making it a priority that kids have daily opportunities and access to this. Space, so that the outdoor space is stimulating and, you know, things like loose parts and things where they can explore. And freedom, the freedom to be able to play the way they choose to play. And I want to touch on this third one for a moment. So freedom, the biggest limiter of freedom is us, the adults in their lives, and our fears and anxieties. So let's dig into those fears and anxieties a bit. If you go to the next slide, we have a situation now, which I call anxiety-based caregiving, so that we as adults are making decisions about what our children can do based on managing our own anxieties, rather than thinking about, you know, what might be best for that child in that situation. So if you go to the next slide, one of the big concerns that people have is injuries, that kids will get hurt. I don't want them to get hurt on my watch. So I want to just touch on some of the injury statistics that I collect, you know, as part of my lab and the work that I do. So this is a good example in terms of, these are the death rates for kids 0 to 19 years from 1950 to 2009. And so you might notice some patterns here. First of all, it's gone way down. In fact, it's never been a safer time to be a child than it is right now. Second of all, why is it safer? Is it because we're engaged in this anxiety-based caregiving? No. So you'll notice that there's a drop around the 70s. So the leading cause of death in the 70s was car crashes, right? So kids in cars. And then seatbelts came in and other improvements like that. And that just like, boom, it really dropped the death rate. So what's the leading cause of death now for kids? It's still cars, kids in cars, and suicide, right? So we're still dealing with those same issues. Play has never been a killer of kids. So if you go to the next slide, just to illustrate that. So I looked at the Statistics Canada data that were available. So this was 13 years of data for death from falls from play equipment, and even more, 20 years of data for deaths from falls from trees. And this is across the entire country. So to give you a sense, in that same time, the 13 years of data, there were 176 deaths from motor vehicle crashes for ages 1 to 14, 176, okay? So how many deaths do you think that there were from play equipment and from trees? Taking a guess. And I would ask you if we were in person, but you can throw it in the chat if you have any guesses. I'd love to hear them. Just throw some numbers out there. 10. Okay, thank you. Any others? More or less? 15, 5. All right. 3, 8. Let's do the big reveal. Next slide. 2 deaths across the entire country in 13 years from falls from play equipment. Not a single death in 20 years from falls from trees. Not one. Okay. I'll remind you, in that same 20-year time period, there were 371 deaths from motor vehicle crashes. So what about not just kind of more minor injuries? If you go to the next slide, I'll just quickly go through this. What this shows is, so injury level 1 is more severe injuries, and injury level 1 is not. It's very mild injuries. It's like Band-Aids and things like that. Injury level 4 are those serious injuries. And this was data that was collected in Norwegian early childhood education environments. We don't have similar data yet in Canada, but you'll see, so the black bars are 0 to 3 years, the gray 3 to 6 years, and then you have girls and boys. And the take-home message here is, yeah, there's a few injuries where you need Band-Aids and things like that. And this relates to us, like injuries occurring in the indoor and outdoor environment. But the injuries that are more severe are extremely rare. And just to give you a sense, if you click for the next, so if you look at these data and the amount of time that kids spend in childcare, there's about one minor injury, so a level 1 injury for every 8 children per year. These are very small. And in fact, when we dig in the data deeper, these tend to be injuries that occur indoors. Okay. So next slide. The important thing too to remember is that when it comes to children learning risk management skills and things like that, keeping kids safe means letting them take risks, because they have to figure these things out for themselves through action. All right, so one thing a concept that might be helpful to consider is the concept between hazard versus risk. So what's your role as an ECE and as an adult? Really, it's to try and manage the hazards in the environment. So the hazards would be things that kids can't manage themselves, broken equipment, those sorts of things. Whereas we want to maintain the risks where they can make a decision for themselves what they want to engage in. And so the general philosophy behind this is that we want to keep kids as safe as necessary, not as safe as possible. We are not trying to prevent every single injury. So how do we change? And I know I'm out of time, so I'm just going to go through this quickly, but we really need to start with ourselves. So if you go to the next slide. So we do have some resources around that. This outsideplay.ca, which is also available in French, we have a parent tool and we have an early childhood educator tool. And so these are tools, they use kind of health behavior change. They take you through some self-reflection. They were based on a lot of research with early childhood educators and some of the big barriers that they experience in supporting this kind of play. And so we take through the most common scenarios that early childhood educators shared with us and the strategies that that the really experienced educators also provided around how to overcome these barriers. So I highly encourage you to have a look at that. Another resource is a risk-benefit assessment outdoor play toolkit. So how do you look at your outdoor environment and think about, differentiating between hazards and risks and managing risks and thinking about the benefits. So next slide, I'll just skip over that. It's just the elements of the tool. But in general, I would encourage you to follow the 17-second rule. And what is the 17-second rule? It's basically every time you want to say, be careful, stop, get down, just count to 17 in your head. Now, what does that do? If you go to the next slide, it provides you an opportunity to go through these processes so that you are actually spending time to look and to listen to what is happening, thinking about, are they managing the risks? Do I really need to get involved here? And then you can act in a thoughtful manner. And acting can also be not doing anything at all. And then reflecting on that afterwards. And so if you think about things that way, it's quite helpful. And also, just next slide, really thinking about only intervening when absolutely necessary. Kids might get hurt, but as it's going to be a serious injury, do you really, really need to intervene? All right, so I think I will stop there because the rest are just resources, and we can come back to them if it seems relevant, but you can go to the Outdoor Play Canada website and these other resources, the encyclopedia. Here's my contact information, but I would encourage each of you to think about what can you do to support outdoor risky play in your everyday practice. So thank you for listening, and I look forward to your questions.